Remember last week, I first told you about an impending one-day strike by the California nurses, National Nurses United. And what that strike was about. A couple of nights later, we had as a guest the co-president of National Nurses United. And they went ahead with their one-day strike on Thursday after receiving assurances from the managers of the hospitals they worked for that adequate care would be provided. While the nurses were out, they made their point. Everything went along okay until the nurses went back on Friday and the hospitals locked them out. 6,000 nurses were locked out for a further 4 days by the hospital chain Sutter Health and the Independent Children's Hospital in Oakland. Now, you can imagine what happened. Judith Ming, 66, died on Saturday at one of the Sutter hospitals after being given what police say was, quote, a non-prescribed dosage of medication and, quote, at lethal levels. The drug was administered by a stand-in nurse brought in from Louisiana by the company that owns the hospital, Sutter Health. About 23, we talked about this last week. Do you remember the woman's name? I'm terrible at remembering names, but I can't think of the woman's name that we had on. Do you remember, Kathy, the head of the Nurses United? I'm drawing a blank, too. But she said about 23,000 members of America's largest nurses union, National Nurses United, were to go on strike last Thursday, and they did, intending to return to their position 24 hours later. Kaiser Permanente allowed 17,000 back on the job. 6,000 nurses were locked out for a further 4 days. One of the locked-out nurses said the union had given 2 weeks' notice to employers before the strike began to allow them to assemble suitably qualified replacements. But apparently that hasn't happened, she said. She said the lockout had been unnecessary and regrettable. She said, quote, qualified nurses were available to work, but management prevented us from returning. So, yes, I believe that the blame for the patient's death lies with them. She added, nurses with 24 years' experience were showing up for work, but were denied entry by security guards, end quote. Deborah Berger, that was the name of the woman that we talked with last week. Now, there's a police inquiry here, and the hospital is carrying out an internal investigation. The medical center's vice president of medical affairs said the death was caused by medical error. And Sutter Health, to add insult to the injury that they caused. See, this is what capitalism does. This is what a for-profit hospital system or medical system or healthcare delivery system anywhere on earth, but especially in this country. This is how management responds. Sutter Health put out a media statement that accused the union of exploiting what Sutter Health calls, quote, the tragic death of a patient to further its own bargaining purposes, end quote. Not anything even remotely resembling that occurred. What happened was Sutter Health refused to open the doors when the one-day job action was over and kept the doors locked for 4 days, during which time Sutter Health is responsible for the death of a patient. But of course, blame the Nurses Association. How dare they for going out on strike? The union says the strike was part of the worsening relations between medical staff and the employers. The unions accuse these hospitals, these massive medical services conglomerates, of driving hospitals relentlessly in a commercial direction and imposing market-based cuts in services, even though they're described as not-for-profit institutions. Oh, right. Of course. The union said management, Kaiser Permanente, Sutter Health, and others, management is trying to roll back on standards of health provision, including the minimum nursing numbers per patient. Why should they, I don't know what the numbers are at any given hospital, why should they have one nurse for 10 patients? Why not have one nurse for 12 patients? Why not have two nurses for 26 patients? Now, in some of the medical centers involved in the strike, the hospital managers acting on the instructions of the capitalist ownership and the for-profit private, I don't care if they're supposed to be not-for-profit, that's hog snot, and you know it is. Managers have tried to change the conditions of nurses so they would have to pay $4,000 more a year to have their own children treated at the hospitals at which they work. And that's a hike, we mentioned this last week, that's a hike that the union members said would make the service they themselves supply unavailable to their own kids. Sons of bitches, kid. I mean, at what point does capitalist America wring out the last drop of goddamn blood out of us that they can get, and then what? They continue to wring. How much longer? Martha Kuhl, again, one of the locked out nurses, said it was inevitable that replacement nurses were less equipped to care properly for the patients who were in these hospitals. She said, quote, "We work together, we know the equipment, we know each other's skills and abilities. When management brought in unqualified or even qualified workers, they don't have that advantage, and that sets people up, unfortunately, to make mistakes." End quote. What does the hospital say? Well, I told you what their statement is, that the union is using the death of a patient to further its own agenda. Unbelievable. Just thought I would let you know, after a one-day job action by the nurses union, the corporate owners respond by locking the doors on the nurses for 4 days. And when the unthinkable happens, they blame it on the nurses. Wow. So typical, so expected, and so much what happens.